MS, as of course, usually it happens for science, is evolving, and there is an exponential growth of knowledge in the area of multiple sclerosis. There are some very hot topics that are particularly evolving. Of course, in the interest of time, I just will focus on a few of them. So the first one is about the understanding of the cause of the disease. We had this very important paper published very recently by Askerio and others from Harvard about the role of Epstein Barr virus in MS that really is consolidating something that is in the air since more than 30 years. But now this evidence is so strong that it is impossible not to consider that. And in fact, my foundation will organize in July from 5 to 8 just a meeting about that in order to have all the scientists debating on the role. What is still not clear, now that is absolutely certain that Epstein Barr has a role, is to which is the modality for Epstein Barr to influence the disease, and if it is just a role in influencing the risk of the disease, or as other data suggest, is also influencing the modality of evolution of the disease. This is a very fundamental aspect. The second one is about the type of classification of MS. Typically, we classify MS in relapsing-remitting MS and progressive MS, primary or secondary. But now the separation seems to be much less clear. There have been data suggesting that there is some silent progression already present in the early phase of the disease. What again is not really known is if this early means since the beginning, or maybe even in the preclinical phase of the disease, or if it takes place at a certain time point, if there is some threshold that can be really determining the evolution from one to another. That's very important because we know that the mechanisms that are operative in silent progression are different than the mechanisms that characterize the relapsing-remitting phase of the disease. Treatments have to be different, and how to use this treatment is really one of the major aspects that we might have in the future. So to me, these are really the two very hot topics. There are many others, but these are the two more relevant.